things. I am an avid fan, strong believer in free market. I believe that free enterprise and capitalism are, some of the greatest concepts that were ever developed. Because I truly believe incentive is very, very important in life. I think we have great products uh, in a whole realm of different categories, and a lot of it is through incentive in the United States. I believe that if one has a talent and the ability and the creativity to come up with new things, he should be able to turn that into, a money-making proposition. Now, and I was recently told that I'm one of the most, and I don't know that I agree with this person, but I was told that I was one of the most generous souls that they ever knew, and that made me feel really good. Obviously, I believe in generosity too. So there's a big difference. We demonize so many companies and so many, we talk about big pharma and we talk about big, you know, oil and such, and we demonize these companies, you know, to a great degree. But where would we be, without them? So with that being said, my thought on the pharmaceutical industry is that thank God we have them, because there was days that I was in pain, and thank God, they came up with pain medicine. Thank God that they have meds that increase my white blood cells. I mean, those shots created a lot of pain. However, if my white blood cells wouldn't have went up, I probably wouldn't be doing this video right now. So I think, the pharmaceutical industry, while we demonize it, it's funny because I think a lot of people that do demonize it don't realize that they're actually probably making some money from them as well. Because if you have a retirement plan, you have money in any type of financial institution, uh, chances are they're probably invested in the pharmaceutical industry to some degree. And why wouldn't they? They're making money. Plus, they invest a lot of the money. They go back and reinvest it. So I think, the only way I think I would be totally upset with the pharmaceutical industry is if a concept would come up, a cure for cancer, a, what I would love to see is a shot that would just prevent cancer, a vaccine that would prevent at least some cancers. And if that was ever discovered, and the pharmaceutical industry would say, well, we don't want to bring this to market because, we wouldn't be able to sell all our other cancer drugs and such, I would have, at that point, then that's bad. Then I'm, okay, I'm with you. They're demonized. But to totally demonize the pharmaceutical industry, I wouldn't do that. There's never been a drug that I haven't been able to get, and as far as my need for cancer. I mean, I'm anti-drug, so I don't want to take drugs. I never took drugs in my life. I really, after college, didn't even drink alcohol. I just, uh, lived a pretty clean life as far as drugs and alcohol are concerned. But now that, I'm sick and, I had to have the pain and stuff, I give some thanks to the pharmaceutical industry. Insurance is necessary. And people complain about the cost of insurance, and obviously it's an issue. And I have, some thoughts on that. But one of the things that people don't realize is if you get sick and you need insurance, they're putting out a lot of money. The amount of money that my insurance company paid this year for my medical expenses were just, insane. And there's things, I think, insurance out of all the types of different categories involving the medical industry, insurance is the most complicated. I never could grasp it. But, the fact of the matter is, I think I did read somewhere about 60% of Americans are happy with the quality of insurance that they have, their health insurance. So when I hear people talk about, like a universal health care package and, we have the Affordable Care Act, I'm generous. I want to help people. I love to see everybody have insurance. But I don't want the quality of the insurance for 60% of the American people to go down. So we all have insurance. I don't think that's the way to do it. If we can get everyone on a quality insurance plan, then I would like that. But, it's laughable when people talk about, we shouldn't have to pay for insurance. Well, it's not free. Nothing's free. Public school is not free. I sent my son to Catholic school, and people, well, why wouldn't you send him to public school? It's free. I said, no, it's not free. I spend several $1,000s a year, and I don't mind. People did it for me when I went to public school, and I do it for them. It's part of life in this country. And, but, on the insurance basis, I mean, it'd be like if all of a sudden we all had to buy Stroman bread. Well, Stroman, first of all, is going to be like, hey, if they're all have to buy our bread, then let's cut the quality. I think one of the issues you have with insurance is you have so many different plans, and some plans are good in some areas, and they're bad or not as good in others. I mean, I have that with my insurance. I do have some issues with like hospice, but you know what? I just sort of went on hospice. As a matter of fact, I'm sitting in my hospice bed in my living room right now. That's where I'm doing this video. So, overall, sometimes you get into these situations where, with insurance, you got to fight for things. But I found my doctors and nurses, everyone taking care of that. There's a lot of coding issues. And I could see, the one thing I do sort of like is a single payer system, in the sense that if we probably could cut down on, the amount of coders. However, if it means we all have the same insurance and it's not a quality program, then, I don't think that that's the way to go. Matter of fact, I know it's not the way to go. The lady who we just raised some money for Team Krause, she had an insurance policy through the Affordable Care Act, and her deductible was astronomical. Which brings me, sort of to my next thing, which is doctors. A lady who had problems with her insurance, she had a doctor willing to do things. He performed 2 surgeries. He cut the costs. He worked around the deductible. She also had a hospital that volunteered to take her in and work with her. Again, these are good people. Doctors and hospitals. And we have a phenomenal hospital system in the United States. Whether you think it is or not, let me tell you, in other countries, your wait time is incredible. I mean, there's probably, I was diagnosed, once they found my tumor, I was diagnosed in a day and a half. I knew I had cancer. I guarantee in a lot of other countries that have, universal health care, it would have been weeks, months. I was able to get in there and get a stent right away, and it provided me so much relief at my biliary duct. And in other countries, that wouldn't have happened. Even in Pennsylvania alone, I think we have 60 hospitals that perform open heart surgery, something like that. Ontario, Canada, has 11. And so, United States healthcare system, I know we can improve upon it, but certainly I think it's pretty good. And my stays at the Lehigh Valley Hospital were amazing. I mean, I had in the cancer unit, they pretty much just have, private rooms. And when you have cancer, because you're in there a lot, you have a lot of family that visits. You have a lot of things going on. It's nice to have a private quality, room, comfortable room. And, again, my care was, as far as I'm concerned, was second to none. Yeah, we didn't get to a point where we could get surgery, but I was cared for, and there was a lot of compassion. Which brings me to, like, floor 7C of the Lehigh Valley Hospital. What an incredible group of people. I was in a couple other units at Lehigh Valley, and they were all good. But for the most part, 7C is the cancer unit. There were some times when we didn't have room and I couldn't go to 7C. Uh, but 7C always made a point to take excellent care of me. They got to know me. As a matter of fact, we gave them all Krause strong bands, and they wear them. The last time I was in there, they actually went down. A couple of the nurses went down to the pediatric unit and got me some blankets and some pillow covers. And they said they wanted to give me a little more color than the traditional white. So I came in, I had like red, white, and blue blanket, and it was pretty cool. And I actually have a lot of the nurses from 7C who are like, they Facebook friend me, and it's awesome. So I owe a lot to those. The nurses, any nurse, they're special. The infusion center at Lehigh Valley Hospital, what an incredible group of people they were. I would go there for chemo, and I was there all the time because I was having trouble staying. I needed fluid, so I would be in there, once or twice a week at least, getting IVs. My hospice nurses and my home care nurse. It's ironic, her name's Ann, just like my wife. My home care nurse, she's just fabulous. I see her the most out of all the nurses, but they've all been great. They come to my house and, do my vital signs, ask me questions, make sure I'm comfortable, and most importantly, they get the fluid out of my abdomen. So overall, yes, we need some things to do. I think I would love to see the pharmaceutical and the insurance industry and hospitals and doctors and such get together and work together. We talk so much about, getting everyone insured, and I think that is an ultimate prize that we can aim for. But I want it to be a quality insurance, not something where, you're going to go broke with deductibles and you're going to have all kinds of other issues. Until we can do that, let's not just push for getting everybody insured without having the quality there. Let's not take quality away from 60% of the people so everybody can have insurance. We still do have a thing, people do have to be self-motivated. I believe in personal responsibility, so you need to look at your insurance. And, maybe if it's not the quality that you have through your job, maybe look at additional insurance. I know it's expensive, but, maybe that's where you say, hey, I'm not going to get the big plan for my phone. I still use a dumb phone. I don't spend money on a smartphone. Or maybe I cut the cable back a little bit. Again, you got to look at what's important and, who's ultimately responsible for this. I believe in the Constitution. I believe in life, liberty, and the pursuit of happiness, and that's the only thing that we should be guaranteed. That's what I believe. I don't think anybody's guaranteed happiness, or I don't believe anybody's guaranteed, I don't believe there's rights to phones and cars and houses, and I think you got to work for those things. And I never knew anybody that wasn't taken care of medically, regardless of whether or not they had insurance. Certainly when they don't have insurance, it increases the price for everyone else, but